The other non-nicotine form of medication to support a quit attempt is varenicline. This is marketed under the brand name of Chantix. This represents the newest addition to the array of medications to support smoking cessation. Unfortunately, although it's the newest one on the block, it has been available for several years. Many patients have tried it, but there are some patients who still have not had the opportunity to have a quit attempt supported by Chantix. Chantix, or varenicline, was a designer drug. It was developed specifically to fit like a lock and key right into the receptor in the brain where nicotine binds. So if you think of yourself coming home from work and putting the key into the door, the key is the nicotine molecule. If the Chantix molecule is already in the lock, the nicotine can't bind. So Chantix works in two ways. It reduces cravings by binding to that receptor. The key is in the lock. Most patients who use Chantix to support a quit attempt report a dramatic reduction in craving for cigarettes, and in that way they are ultimately more successful in quitting. This does require a prescription. Many health plans provide partial coverage for the prescription. It's important to talk to your doctor again about whether this would be a good medication for you, but in general, a major advantage of Chantix over Zyban is that it does not have any drug-drug interactions, and unless you have severe renal disease and require hemodialysis, it does not require any adjustment in dosing. When using both Zyban and Chantix, it's important that you work with your doctor to set a quit date. The quit date is usually identified as about 8 days after starting one of these two medications. Over the first week, you take the medication as prescribed, and the level gradually builds up in your bloodstream until it reaches a point where it becomes effective. That generally occurs on about day 8. On day 8, which again is your quit date, that's the point where you're not going to have any more cigarettes, not even a puff.